Yes.
I would like to say that this had been mentioned a few weeks ago about insurance, about oxygen. We had one, I think you had talked about the oxygen, somebody was sitting on that side of the room, about the oxygen not getting paid for and after so many months. So you're the gentleman up front who said he wrote Medicare and said, why aren't you paying for it? So this is something we're all getting out of this support group because we have to become our own advocate. So it took not only the owner of the business, but a patient saying, hey, what? You're killing me here. You know, you're going to take my machine. So we have to be advocates for ourselves. So that's kind of the whole thing. And as a support group, I think that made a great example. So I encourage everyone here for any denial that you get on your insurance or, you know, they call and write and say they didn't pay your doctor for this, to always ask a question and find out what it needs to make them aware of getting the reimbursement, because it only helps us and then future people down the road get what they need.
Unfortunately, two of my daughters work in medical coding, and when they refused payment on my Trilogy, they dug into it and found out that Medicare was not even following their own guidelines. And stuff papers like this went to Medicare along with the appeal, and within 30 days they approved it.
Wrong codes.
No, like codes, they just ignore them.
I was told someone put the wrong codes.
Well, they do, but this time it was coded correctly.
So the Trilogy device is a BiPAP
No,
machine, or a ventilator, or
yeah,
I'm sorry,
so it's called non-invasive ventilation. So
Non-invasive.
it's biphasic in the sense that there are two pressures.
Their own
Okay.
and their
But as far as the device itself, it's much more to it
Trilogy.
involved in it.
non-invasive. What'd you say?
Ventilator.
Ventilator.
Yes, ma'am.
COPD.
Are there studies, like,
Yes.
data support
Yes.
for this?
There's tons of it.
What about in combination with exercise?
Yeah. So with
Because I
COPD,
can't exercise,
correct.
hardly.
Yeah.
But would that help me be able to exercise?
Yes.
And would
So
that be good?
yeah. So with COPD, the more you exercise, for anybody, the more you exercise, the more carbon dioxide you produce. Your body does.
Right.
And if you have a chronic obstructive lung disease, you produce more of it when you exercise. So you have to get rid of that somehow. And so this device will actually help you with rehabbing as well.
And the general criteria to get the Trilogy is what? Hospital exacerbations?
Yeah, so normally for us, we request arterial blood gas results, which you normally have anytime you're hospitalized.
What if you're never hospitalized for an
So
exacerbation?
you would get it to your pulmonary doctor, and y'all have to have that discussion.
Do doctors know about it?
Yes, most of the doctors in this area do, for sure.
I wonder why. Okay, thank
Another
you.
thing that I'd like to say too, if you don't mind, Darrell, is about the program. So patients that come out of the hospital that get entered into our program, when Darrell was talking about patients having to wait 2 to 3, 4 months to see your physician, Pulmonary Association now has an outpatient COPD clinic that they're seeing patients on Monday, Wednesday, and Friday. So post-hospital patients are guaranteed to be seen within 2 weeks, which is huge, because before that, patients were waiting months to be seen at the hospital.
Any other questions? Yes, ma'am.
Are you familiar with Hayek?
Yes, ma'am.
How does this compare with the Hayek then?
So the Hayek is a form of they both essentially do the same thing, but the Hayek is negative pressure ventilation, and this is positive pressure ventilation. I'd be more than happy. We do
I use
Hayeks.
a Hayek.
Yeah, we do Hayek, so I'd be more than happy to come back and do a whole presentation on that as well. There's much more to that, for sure. But they essentially both do the same thing, just in a different way. Yes, ma'am.
In order to use this company, you actually have to be here from hospital.
No.
Repeat the question.
Yeah, so she asked, in order to use our company, you actually have to be in the hospital. No, ma'am. Most patients are identified in the hospital, but in order to use our program, you do not have to be in the hospital or have been in the hospital.
So what do they need to do, talk to their pulmonologist?
Yes, yes. So most of you would probably need to talk to your pulmonary doctor and get a better feel for what they would like to do and how they would like to go about getting you enrolled in a program such as this.
Can we anticipate the program being available to people with other pulmonary conditions such as pulmonary fibrosis, a different type of program?
Yes, so we have, like I said, we've only been doing this for about 4 years, but we are looking into other issues as well, such as congestive heart failure, pulmonary fibrosis. There's lots of other chronic lung diseases that we have looked into as well. So the program may be an option for you, but I would discuss it with your doctor first before pursuing anything else.
Any other questions? Guys, if you have anything that you want to ask after this to the group, please do so, okay? Contact information is up here. You're more than welcome to call that number as well, correct?
Correct.
And on behalf of Breathmatters,
Oh.
we don't want you to forget us.
Oh, thank
And we
you.
really appreciate your time and energy to provide education to
Yeah,
us.
thank you so much for having me. So I'll be around for however long I need to. So if you have any questions.
Perfect.